are so excited to be here. Every week we bring you information from experts that applies to women's health. And this week we have with us, and we're so excited, Dr. Jaimie Glick, who is a clinical assistant professor of dermatology at New York Presbyterian, Weill Cornell, and my longtime colleague, Dr. Nikole Ostrov, who is a gynecologist who has been working for Maiden Lane Medical with us for about the past 9 years. Let's talk about dermatologists and what dermatologists do. So my understanding, there are two main areas in dermatology: cosmetic dermatology, which you can tell us about in a moment, and then there's medical dermatology. So what do cosmetic dermatologists do mainly?
Cosmetic dermatologists focus on making us more beautiful. So we focus on botox, filler, laser, skin quality, skin texture. I mean, it's a really vast field. I specialize in cosmetic and medical dermatology. I feel there's a lot of overlap. Like, let's say you have an acne patient. A lot of acne patients complain about acne, but even when I clear up their acne, they start to complain about this dark spots or the leftovers and the scars. So sometimes that's even more concerning than the acne itself. So there's a lot of overlap between the medical and the cosmetic aspects of dermatology.
So you do both?
I do both. I do both. Yes, it's my favorite part. I can do it all. You know, the patient comes in, they want us to clear their skin. We can clear their skin from acne, then we can clear their skin from the, the marks and the scars, and it's really rewarding to be able to do the whole spectrum.
So let's talk about one of the most common things I believe we see together, which is acne. Let's talk about acne. What is acne?
Acne is basically a disease of what we call the pilosebaceous unit. So it's basically the muscle, the hair, in the sebaceous gland. So I actually trained under Dr. Alan Chalita, who is the world's expert on acne. He basically identified the pathophysiology of acne. And we're still actually, as common as acne is, we're still trying to understand what causes acne. But I usually tell my patients it's a combination of 4 factors, basically 4 plus, I say. So clogged pores, or something called hyperkeratinization, inflammation, oil glands, or overgrowth of the sebaceous glands, and bacteria. And all of those mix together basically to form an acne lesion.
So I had a lot of acne as a kid, and I know a lot of women also have acne as a kid in their teen years. When they hit puberty, acne tends to increase, so far as I understand. Isn't that supposed to stop at some point?
I would actually say the most common person in my office for acne is a 20 to 30 something year old young female. I don't know if this will offend you guys as gynecologists, but I think that there is a big association between hormonal acne and IUDs. I always joke to my patients that sometimes, the Mirena and Skyla IUDs keep me in business.
Hold it. That's not only not offensive. Dr. Glick, you're totally right. We definitely see more acne in women who have the progesterone containing hormone IUDs than women who have non-hormone containing IUDs or are on nothing. And here's the reason why. It's because the progesterone, levonorgestrel, which is a hormone inside that IUD, the hormone has some what are called androgenic side effects. And some women tolerate those androgenic side effects very well. And androgenic side effects are things that give you a testosterone-like side effect. So things that would make your skin oily, your hair oily, make you potentially gain weight, and give you some acne are typical androgenic side effects that we see. The reason you think it's so common is because those are the only patients you're seeing with hormone-related, or probably other than maybe polycystic ovary syndrome patients, the only patients you're really seeing with hormone-related acne are the ones with the IUDs. But the real data is that we only see it about 5% in about 5% of women who have hormone containing IUDs. You're seeing 100% of those 5% of women. That's the
Yes.
observation bias. Go ahead, Dr. Ostrov.
I was just going to add in too that sometimes there's also the bias of there's a lot of women that stop their oral contraceptive that actually can be beneficial for their acne. I'm sure Dr. Glick would agree with, because a lot of those progesterones can be more anti-testosterone, and they've switched from the pill to the IUD. So a lot of them have that bias too, because they've stopped something that was actually helpful for them and started this IUD that does have this, a little bit more androgenic activity.
Agree with you, actually. I think patients tend to come in more because they never had acne and now suddenly they do, and they want to go to the dermatologist, even more so than necessarily someone who's been struggling with it for most of their life.
I think from our standpoint, from a general, both cosmetic standpoint and social standpoint and feeling about yourself standpoint, patients should really know that there's a 5% or so chance that the hormone that's contained in their hormone-containing IUD is going to lead to adverse skin effects.
I also think that a lot of times patients get on the IUD so they don't have to take a pill, right? That's one of the common areas. And then they come into my office, and then sometimes I have to start them on spironolactone or an antibiotic or another pill, and it's kind of like replacing one pill for another pill. So I definitely think educating them that, if that's the primary reason, you may want to consider something else, just talking about all their options. I sometimes do prescribe birth control for my own patients, but oftentimes I'll send them first to a gynecologist, especially if they've never been evaluated before, because you guys are certainly the experts on all the different options out there.